Welcome to the Deep Dive. Today we're taking a really focused look at a topic that affects so many people worldwide, breast cancer.
Yeah, and for this deep dive, we're sticking to just one source, which is a fact sheet from the World Health Organization's website.
Right, so our mission today is pretty clear. We want to unpack the key facts, understand the risks, what symptoms to look for, the treatments, and the bigger global picture of breast cancer based only on what's in this WHO document.
And right away, the scale of it is quite stark. Just looking at the numbers globally in 2022, it caused, get this, 670,000 deaths.
Wow, 670,000. That's a huge number. And the fact sheet also points out how incredibly common it is. It was actually the most common cancer in women globally in 2022.
Yeah, in like 157 countries. So basically, what is breast cancer? It starts when cells in the breast, they start growing abnormally, dividing when they shouldn't, and they form these tumors. Usually starts in the milk ducts or the lobules.
Those are the glands that make milk, right? And the document, it makes this really important distinction, doesn't it, about the earliest stage, in situ.
Exactly. In situ means the cells are still contained, so it's not actually life-threatening at that point. The real danger starts when those cells break out, invade the tissue around them. That's invasion. You might feel a lump then.
And if it goes further, spreading to lymph nodes or, other parts of the body like the lungs or liver, that's metastasis, and that can be fatal.
So let's dig into that global picture a bit more. You mentioned the 670,000 deaths in 2022. Well, alongside that, 2.3 million women were diagnosed just in that year.
2.3 million diagnoses.
Yeah.
And it can happen to women at any age after puberty, right? And it's literally in every country.
Every single country. But here's where, like you said, it gets really, really interesting and frankly quite sobering, is when you look at the data based on the Human Development Index, the HDI.
Yeah, tell us about that. That contrast is pretty stark.
It really is. It's one of the most powerful points in this fact sheet. So in countries with a very high HDI, I think, wealthier nations with developed health systems, about 1 in 12 women are likely to be diagnosed in their lifetime.
Okay, 1 in 12. That sounds like a high chance of getting diagnosed. But then what about dying from it in those countries?
That's the flip side. In those same very high HDI countries, the risk of dying from it is much lower, only about 1 in 71 women.
Okay, so high diagnosis rate, but lower mortality rate. Now, compare that to low HDI countries.
Right. In low HDI countries, the chance of getting diagnosed is actually low. It's about 1 in 27 women over their lifetime.
Lower diagnosis rate.
That's correct.
Okay. But the mortality.
That's where the story flips dramatically. The risk of dying if you are diagnosed in a low HDI country is way higher, 1 in 48 women.
Wow. So let me get this straight. Fewer women get diagnosed in low HDI countries, but if they do get it, their chance of dying is significantly higher than in high HDI countries.
Exactly. Almost a 50% higher risk of death compared to very high HDI countries. It really hammers home the role of, access to timely diagnosis and treatment. That disparity is huge.
Okay, definitely a key takeaway. Let's shift gears a bit and unpack the risk factors mentioned in the sheet. It's very clear on the biggest one, right?
Absolutely. The strongest risk factor, hands down, is being female. About 99% of all breast cancer cases are in women.
And that other 1%?
That's men. About 0.5 to 1% of cases occur in men. And importantly, the fact sheet notes the treatment principles are essentially the same whether you're male or female.
Good to know. So beyond just being female, what else increases risk according to this document?
Well, there's a list. Getting older is a big one. Obesity, harmful alcohol use, having a family history of breast cancer.
Okay.
Also, a history of radiation exposure, especially to the chest area. Then there are things related to reproductive history, like the age you started your period or your age at your first pregnancy. Tobacco use is on the list, too, and using postmenopausal hormone therapy.
That seems like a comprehensive list.
Yeah.
But then there's this really surprising fact in the sheet, isn't there?
Oh, yeah. This one really stands out. Roughly half of all breast cancers happen in women who have no specific known risk factors other than, being female and getting older, usually over 40.
Half. That's incredible. It means you really can't assume you're safe just because you don't tick those other boxes, like family history or lifestyle choices.
Precisely. It underlines that every woman needs to be aware.
And speaking of family history, it does increase risk. But the fact sheet points out something important there, too.
Right. It says most women who are diagnosed with breast cancer actually don't have a known family history of it. So just because no one in your family has had it, that doesn't automatically mean your risk is low.
That's a crucial clarification. Does it mention genetics at all? Specific genes?
It does. It talks about certain inherited gene mutations, calls them high penetrance mutations, things like BRCA1, BRCA2, and PALB2. If you have one of these specific mutations, your lifetime risk is significantly higher than average.
And for women who know they have these mutations.
The sheet mentions that risk reduction strategies, maybe like preventive surgery, removing breasts or ovaries, or taking certain preventative medications, might be options to consider.
Okay, so moving from risk to actually spotting it, what are the signs and symptoms? The document emphasizes something about the early stages, right?
Yeah, it really stresses that in the very early stages, most people have absolutely no symptoms, zero, which again highlights why early detection methods or awareness are so important.
But when symptoms do appear, maybe as it gets a bit bigger, what should people look for?
The most common sign mentioned is a lump or some thickening in the breast tissue, and often, interestingly, it doesn't hurt.
A painless lump. Okay, what else?
Changes in the size or the shape or just the general appearance of the breast. Skin changes are another one, like dimpling, redness, or pitting. Sometimes they say it looks like the skin of an orange.
Orange peel skin. Yeah, I've heard that. What about the nipple?
Changes there, too. Could be changes to the nipple itself or the skin around it, the areola. Also, any unusual discharge from the nipple, especially if it's bloody.
So the advice here is pretty straightforward.
Very clear. If you find any abnormal lump or notice these kinds of changes, you need to see a doctor or healthcare provider promptly, even if there's no pain.
And it does offer some reassurance, saying most lumps are not cancer.
Exactly. Most are benign, but you have to get it checked because if it is cancer, catching it when it's small and hasn't spread makes it much, much more treatable.
Right, and what about if it has spread? Does the sheet talk about symptoms of metastasis?
It does. It mentions the first place it often spreads is the lymph nodes under the arm. You might not even feel those, though.
And if it spreads further to other organs?
Then you might get new symptoms depending on where it's gone, like bone pain if it's in the bones, or headaches if it's spread to the brain. Lungs, liver are other common sites.
And it also mentions something about advanced cancers and skin changes.
Yes, in very advanced cases, the cancer can actually break through the skin, causing open sores or ulceration. The sheet notes these aren't always painful, but they definitely need immediate medical attention and a biopsy.
Okay, so let's talk treatment. How is breast cancer treated according to this fact sheet? It sounds like it depends on the specific cancer.
Absolutely. Treatment is very personalized. It depends on the biological subtype of the cancer, its specific characteristics, and also how far it has spread, which is called the stage. Stages 3 versus stage 4, for example.
And it's usually not just one thing, right? It's a combination.
Generally, yes.
Sure.
A combination approach is used to try and stop the cancer from coming back. That usually involves surgery, radiation therapy, and different kinds of medications.
And the timing is crucial.
Crucial. The fact sheet really emphasizes that treatment is most effective when it's started early and, importantly, when the full course is completed.
Okay, let's break those down. Surgery, what are the options mentioned?
Two main types. Lumpectomy, where they just remove the tumor and a bit of tissue around it, saving the breast. Or mastectomy, which is removing the entire breast.
And lymph nodes. Sometimes they're removed too.
Yes, sometimes lymph nodes in the armpit are removed to check if the cancer has spread there. The sheet mentions that nowadays they often prefer something called a sentinel node biopsy, removing just the first few key nodes rather than taking them all out because it causes fewer long-term problems like arm swelling.
Okay, that makes sense. What about radiation therapy? What role does that play?
Radiation is another key part. It's often used after surgery to kill any remaining cancer cells in the breast area or chest wall, reducing the chance of it coming back there.
Even after a mastectomy?
Yes, even after a mastectomy, it can reduce recurrence on the chest wall, and in some advanced cases, radiation might even help improve survival. It can also sometimes, for early cancers treated with lumpectomy, help avoid the need for a mastectomy.
Got it. So surgery, radiation, and then medications. How are those chosen?
Those are selected based on the tumor's specific biological markers, like what's driving its growth. And the sheet notes, many of these essential drugs are on the WHO essential medicines list, meaning they should ideally be available.
Can you give us an example? It talks about biological subtypes, right?
Exactly. So if a cancer is hormone receptor positive, meaning it uses hormones like estrogen or progesterone to grow, often shown as ERPR positive, then endocrine therapies or hormone therapies are usually effective.
Like tamoxifen.
Tamoxifen or another class called aromatase inhibitors. These are usually pills taken for 5, sometimes even 10 years. The fact sheet says they can cut the risk of recurrence almost in half for these cancers.
Any side effects mentioned?
They can cause menopause-like symptoms, but generally they're considered well tolerated.
Okay. What if the cancer isn't hormone sensitive, hormone receptor negative?
Then those hormone therapies won't work. So unless the cancer is really tiny, chemotherapy is usually needed. The good news is modern chemo is often effective and can frequently be given as an outpatient.
And there's another type mentioned, HER2 positive.
Right. That's when the cancer cells make too much of a protein called HER2. For these, there are targeted biological drugs, like trastuzumab is mentioned. These are given with chemotherapy and specifically attack those HER2 positive cells.
So lots of different approaches depending on the specific cancer. But the common thread is
Completing the full course of whatever treatment is prescribed, the document hammers that home. Finishing the treatment is vital for it to work properly.
okay, let's zoom out a bit now. What does the fact sheet say about global efforts and progress? Has there been any?
Yes, definitely progress in some areas. It highlights that in high-income countries, the age-standardized mortality rate, that's a way to compare death rates fairly across different populations, actually dropped by 40% between the 1980s and 2020.
40%. That's a huge improvement. How did they achieve that?
The fact sheet attributes it mainly to strengthening fundamental health systems, basically making sure the known effective treatments could actually reach the patients who needed them reliably, a reduction of like 2–4% per year in those countries.
Strengthening health systems. What does that mean in practice for breast cancer?
It means having clear, reliable pathways. So a patient can go from primary care, get referred smoothly to a district hospital for diagnosis, and then on to a specialized cancer center for comprehensive treatment. It's about connecting the dots in the healthcare journey.
And there's this interesting concept mentioned, breast cancer as an index disease.
Yeah, I thought that was fascinating. The idea is that if you build good pathways and systems for managing breast cancer, those same pathways, the referral systems, the diagnostic capacity, the treatment centers, can then be used or adapted for other common cancers too, like cervical, lung, colorectal, prostate cancer.
So improving care for one major cancer helps lift the boat for others.
Exactly. It creates a foundation.
Is the WHO actively working on this globally?
Yes, through its Global Breast Cancer Initiative, or GBCI.
And what's the goal of that initiative?
It's pretty ambitious. They aim to reduce global breast cancer mortality by 2.5% per year. The overall target is to save 2.5 million lives from breast cancer between 2020 and 2040.
2.5 million lives.
Right.
Wow. How are they planning to do that?
It's based on three main pillars. First, health promotion for early detection. Second, making sure diagnosis is timely once someone has symptoms. And third, ensuring comprehensive management, which means access to effective treatment and supportive care.
And a big part of that first pillar, early detection, is about awareness.
A huge part, especially according to this fact sheet. Public health education, making sure women know the signs and symptoms and understand why it's so important to seek help early, that empowers more women to get diagnosed when the cancer is more treatable.
And this is important because?
Because, as the document points out, this awareness approach can make a real difference, even in places where widespread mammogram screening isn't really feasible, maybe due to cost or infrastructure limits. Just knowing the signs and acting on them is a powerful tool in itself.
So wrapping up our deep dive into this WHO fact sheet, we've really covered a lot, haven't we? The sheer global scale, those stark inequities based on where you live.
Yeah, the different risk factors, and that surprising point about many women having no specific risks beyond age and sex. Then the signs to watch for, the different treatment approaches.
Right, how treatment depends on the cancer's type and stage.
Yeah.
And finally, these global efforts focusing on strengthening health systems and boosting awareness for early detection.
It's a dense fact sheet, but it gives you a really solid overview based on this one authoritative source. Hopefully, unpacking it like this helps make sense of it all.
Definitely. And maybe final thought to leave everyone with, something that really struck me from this data, it's that incredible contrast. Lower rates of diagnosis in low HDI countries, but a much, much higher risk of dying if you do get diagnosed. What does that really tell us about the power, the absolute necessity of strong health systems and equitable access to care in turning the tide against this disease globally? Something to really think about.